Heights. This morning I'm going to talk about the definition of health. And I think this is important because as we define things, it may change the way we think about things. So health, according to the World Health Organization, in 1946 said that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It's kind of ironic that as a doctor I'm talking about health because what we learn in medical school is all about diseases. In fact, I had a friend that worked in Geneva next to the World Health Organization, and he would ask people he met that worked at the World Health Organization if anybody was working on the sense of well-being. And he said he couldn't even find anybody that knew anybody that was working on well-being. Absolutely everybody was working on the absence of disease. So these things have changed around a little bit in our country, and people have realized that we need to work more on health. And even though we need to be very good at taking care of diseases when people go to the hospital and are acutely ill, we're much better off if we could get everyone to be healthier. And one of the ways to do that, as is often the case, it's the small little things that you do every day that can make a big difference in the long run. Otis Brawley, who actually trained here in Cleveland and was Rochelle's senior resident when she was an intern, is now the chief medical officer of the American Cancer Society. And he said if there's one thing he would try to do for America to improve the health, it would be to get everybody a health coach, someone to encourage people in healthy habits. One of the things that this definition leaves out is spiritual well-being. And they actually had conversations about that at the time they made the definition and wondered if it should be included. Now, we in the church know that spiritual well-being is the most important aspect of health. And so we need to do what we can to be spiritually fit. And that means, absorbing the wisdom from our Bible. It means fellowshipping with our fellow Christians, and that also helps the social and the mental well-being. One of the things that we know helps people is just to be outside. In Japan, there's a practice that's called tree bathing, and really what it is just walking in the forest. But it has been shown to improve people's health. And in fact, if a neighborhood has green spaces in it, then the health of that neighborhood tends to be better than similar neighborhoods that don't have any green space or any parks. So think about health as the sense of well-being, and even though you may have what we would call a disease or a chronic conditions like diabetes or high blood pressure, can you still be healthy is the question? And the answer is yes, as long as you're cultivating this sense of well-being in all these different realms. Benjamin Franklin famously said, beer is proof that God loves us and wants us to be happy. Now, while I wouldn't endorse the beer part, I do think God loves us and wants us to be happy. And we need to figure out how to partner with God in order to make that happen. Thanks for listening. We'll see you next week. Take care.